Good morning, everybody. You're joining me from a very rainy London. It's a terrible morning, but thank you for getting up bright and early and being here for our PiP Health and Wellbeing seminar. I'm Jan Carlos Kucharek. I'm acting deputy editor of the RIBAJ journal, and I'm editor of Products in Practice. Interesting, a day after blood tests were being trialled that I found out yesterday on the news that have the capacity to detect up to 50 different kinds of cancer, it kind of made me think that there's actually probably more of an awareness that we need to have suitable care facilities for what's already an overstretched NHS. But the idea that, you know, given that we might get more of an early warning system there to kind of detect cancers in the first place, that I imagined the strain on hospitals would be more that we're dealing with large numbers of people coming into them in order to, as a kind of like early warning preventative measures, rather than kind of severe curative ones. And I kind of wondered how in the future that would really have an effect on, you know, how something like a blood test for cancer could have major effects on the capacity of the NHS estate. In that context as well, we've just recently announced the RIBA National Awards. We had 54 of them this year. And it was interesting that we did them sectionally this year for various reasons. And it was interesting to find that only 2 of them were actually health buildings. And I kind of wondered, is that surprising or not? My kind of personal perception of it is I think there's actually only a few memorable examples to pull out of a slew of probably quite well-meaning and safe medical facilities that we've seen designed recently. I used to go to school in Swindon, which I actually have quite a fondness for. The city itself, a lot of people kind of don't really like Swindon, but I think it's a fantastic place in some regards. But I remember with sadness when Powell and Moyer's 1966 Princess Margaret Hospital, which used to sit on the side of the hill in Old Town, I used to call it the paddle steam because it looked like one. But as a building, I always remember it being filled with aspirations of light, air and openness, which were the true modernist ones. It had a central corridor, you had light either side, very large windows, so if you were in a bed you could actually see out very clearly. And all of that was kind of made way, you know, demolished in 2002 to make way for a facility which I think suffers an awful lot of the endemic problems of most healthcare facilities nowadays. Notably, I think with the idea of wayfinding, there's such deep plan hospitals, you can never really know where you are. You don't get a sense of that. But I mean, thankfully, I think there's an awful lot of good examples of healthcare buildings. Guys on St Thomas's Trust have produced some amazing additions to their estates over the years. And the Maggie Centres, most recently, we covered it in PiP actually, the latest issue, Maggie Southampton, I think kind of remain inspirational examples of how modern architecture can contribute to well-being. Obviously, with new challenges with COVID, we're still in the process of understanding what the new normal is and how our lifestyles and habits are changing, and how buildings have to reflect those changes. But I think that in reality, that we're arguably going to have to start with far more healthy and direct relationships with the open air. And I think our speakers today will be alluding to all of these issues and more in this webinar. Before I introduce our first speaker, a bit of housekeeping. I believe that questions can be fielded to me via the chat button, and I'll address them to the speakers in the 5 minutes or so that we have between speakers going live at the end of their presentations. Speakers, I may interrupt you. I'm not quite sure how that one works, but I may be interrupting you if you're overrunning. So I'll just ask you to round them up slightly quicker. So I'm not being rude. I'm just trying to keep everybody to time. I know that architects and our listeners, our watchers, are, you know, have busy lives and generally have to kind of stick to their own schedules. So to our first presenter, this is Sumita Singha OBE, who's Director of Ecologic Architects and an author. She was actually involved in the Rethink Design Guide, which last year the RIBA ran, RIBAJ ran it. It's an RIBA Arab initiative to kind of rethink about how to rethink design in the immediate aftermath of the pandemic for key architectural sectors. And we looked at housing, workplace, civic and cultural, hospitality, education, infrastructure, and civic placemaking. These results were all published in the RIBA journal, I believe it was last September or October. And the book provides design inspiration to architects on how they can respond to these challenges in a post-pandemic environment. Sumita's other book, Future Healthcare Design, describes how architects can design better healthcare facilities for rapidly changing contexts and climate. Innovation in the design of healthcare estates is essential to the sustainability of our health services, as I described before, and design thinking in this field is being influenced by a range of factors, certainly economic constraints, but other issues like aging demographic, complex healthcare conditions, and climate change. And there's many opportunities for architects and designers generally to work within this field to try and push forward design quality in healthcare buildings. And I think that's what Sumita is going to be talking to us today. So Sumita, if you're ready, please go ahead with your presentation. We'll be receiving questions afterwards. Thank you. Good morning, Sumita.
Good morning. Can you hear me?
Loud and clear on this end.
Good. Okay. Thank you very much, Carlos. So as you've said, you've introduced me briefly. I'd like to add that I'm a chartered architect who practices architecture in different ways. I design, I write, I teach, I have trustee roles in architecture, and I'm RIBA counsellor. I consider myself a cheerleader for all good design. So if you can go to the next slide, please. So this is a community centre that I've been involved in retrofitting using eco-friendly technology. And sustainability, community and health have become very important to me over the years. And next one, please. So throughout my 30-year journey in architecture, I've documented what I've done by writing about it. And Carlos mentioned 2 of those books. These are all the books I've written so far, and I consider them as practice-based research. So the last 2 books, which were about healthcare, were interesting because the first one, Future Healthcare Design, came out just as the pandemic started in 2020. Coincidence, I didn't bring on the pandemic and write a book about it, but that's how it happened. And then the second one, which I'm a contributing editor of, was also published at the beginning of this year. So I'm not going to talk about the issues in the book. I think there's a discount being offered if you want to buy those books. But I've selected some highlights and some provocations in this talk. Next one, please. So I have an advisory role as well in the NHS. I'm a non-executive director in an NHS trust. And during my time there, I've noticed that design is not valued very strongly. Very poor processes and fees for architects. Procurement processes are heavily in favor of low fees. So even if your design is good, the person who's offering the lower fees will probably get the job. So I've spent about 9 years being really frustrated at the NHS. And I've been trying to understand and improve the processes involved in employing architects for design services. This project that you see on the slide is the new Moorfields Eye Hospital. It's due to be started at King's Cross, London. The architects were due to be selected using the framework process, but I determined that an RIBA competition would produce a more innovative design process. So a design competition was actually held. And I also encouraged wildcard entries. You've just seen, like, last few days, how wildcard entries can actually influence the sports, and why not for architecture? So I selected people that had not designed a hospital before. And this is the design that was selected in the end. It is by Pinoy and Prasad. I've also contributed to understanding and improving sustainability within healthcare as part of the NHS Sustainable Development Group. Water usage, for example, energy use, very high in hospitals. And I'm also campaigning against the use of large amounts of disposable products such as masks, gloves, and wipes. So if we go on to the next slide, please. So the NHS started out in 1948 as a free at the point of delivery service. It has been a huge success, but its premise was always based on continued investment into healthcare and also including its estates, and this clearly hasn't happened. So while people are living longer with complex illnesses, half of the estates are more than 40 years old. Now, estates being 40 years old is not a problem in itself, because obviously there are Victorian hospitals which are older and they are still in use. The problem is the lack of maintenance. Next slide, please. So patient experience in poorly maintained hospitals is suboptimal, with injuries and infections on the rise. Let me give you some examples which I've written about in my book. So in one hospital, patients were offered ice creams in hot weather when the wards became unbearably hot. In another one, a young mother died after getting lost in a corridor while looking for her newborn son. And then continuously hear about theatres where you have rat droppings in and around the theatre. So the very environment that is supposed to be healing is actually hurting people. And these are two examples, very recent examples of this hospital, which is going to be looking at corporate manslaughter, and the other one where the floods in London, the water just poured in and the accident emergency couldn't be used at all. So while medical and pharmaceutical innovations have moved on, the question of what makes a good healthcare building remains. Ideas such as specific shapes for hospitals, I've come across those, or patient pathways do not always work. Regarding funding, funding has gone down, as I said, and PFI hasn't quite delivered its promises, and it's been withdrawn since 2019. Next slide, please. So in the meanwhile, the NHS continues to remain at the centre of politics. It was, as you know, used for the UK's referendum on the EU, and also for the last elections in 2019, when 40 new hospitals were promised. However, a quick calculation shows us that 40 hospitals cannot be delivered on the basis of the budget allocated to it. So in its latest announcement, the government committed the money to upgrade 6 hospitals by 2025. Up to 38 other hospitals received money to plan for building work between 2025 and 2030, but they're actually unable to begin any work. In the meanwhile, a few months later after the elections, as you know, the COVID pandemic hit, with most of the financial resources being diverted to dealing with those problems alongside ongoing staffing and estates problems. And as a non-exec, I was quite involved in planning for the workforce and seeing how we could use our hospital in different ways. So in my experience, hospitals, again, you can see the case studies in the book, hospitals take an average of 7 to 8 years to be built. So clearly we face the prospect of not even the 6 hospitals being upgraded during the term of the present government. Next slide, please. This slide is very interesting because you see that the maintenance backlog on existing hospital has been growing daily. The promised money tree hasn't actually materialized, and the proportion of high and significant risk has been growing since the last decade. Yesterday's news report said the NHS makes people proud to be British, but 1 in 5 have been forced to go private. There was a survey of about 4,000 adults in the UK. Some complained of having to fight for treatment while others faced discrimination. It was a research by charity Engage Britain. In the meanwhile, the biggest threat to humanity and health is unfolding globally. This is the climate crisis. Unlike the pandemic, we cannot self-isolate or medicate against the climate crisis. The climate crisis will be the equivalent of a COVID crisis every year from the middle of this century. So what do we do? Next slide, please. So coming back to the question I posed at the beginning of whether we need new hospitals, considering the fact that we don't have enough money to build it and time's running out, in the meanwhile, people are really suffering, I suggest these few things. So we need to invest in terms of the backlog maintenance, really concentrate on that, pull up our socks and get our hospitals in order. Then the second thing, retrofitting hospital buildings will be a good solution. There are many buildings, as I've mentioned, including Victorian ones, which are in perfectly good condition, but would require some sensitive retrofitting and maybe addition to function properly as hospitals. This will not only mitigate against the worst effect of climate change on the users, but also help by not adding to the operational and embodied carbon dioxide. The NHS has set an ambitious net zero agenda, so this will also help. Then third, we need to engage in planning our cities and buildings to prevent hospital admissions, actually. And so we are looking at wellness centers and improving our cities and places where we live and work. So improving the quality of those will be actually excellent in preventing hospital admissions. Community and general practice should be the first net to catch and prevent spread of serious illnesses. We will, of course, continue to need specialist hospitals like the new Moorfields Eye Hospital that was shown earlier, acute care hospitals for serious illnesses and emergency units for accidents and emergencies. We have to shift away from thinking that hospitals are for everyday use. What I'd like to see more is preventative urbanism, where urbanism is used to prevent ill health. So healthy cities using zero carbon or carbon negative technology. This means adaptive and intelligent homes where residents are able to monitor their health and live in them for a long time, in fact, until the end of their lives. Finally, I suggest investing in research into illnesses and public health information. After all, we are the best people to know how we are feeling and take care of ourselves if we are able to. And since the most life-threatening illnesses these days are lifestyle caused, by encouraging healthy eating, health education, and lifestyle will be worth every penny. The good thing about all these solutions is most of them, except one, encourage the use of architects in healthcare design, and they elevate the value of architecture and good design as well. Thank you for listening.
You're muted. Press to unmute your microphone. I can't unmute my microphone. Can you see me? The host says start your video. There we go. Hello. Sorry, there was a minor housekeeping issue there with trying to get the video to switch on. Apparently someone else can control my video, which is curious. Interesting. Thank you very much indeed, Sumita. I think, I mean, very broad-ranging issues there, I have to say. I don't quite know where to start. It's such an enormous subject. The idea of kind of completely changing our cities to kind of minor changes to, you know, Victorian retrofits of hospitals. I think it's such a broad-ranging subject, one doesn't quite know where to start with it all. Couple of points. I mean, firstly, the idea about, I was interested in the fact that Penoy and Prasad ended up doing the hospital at King's Cross, because that wasn't necessarily a wild card issue as you were talking about there, because obviously Penoy and Prasad were involved in the Moorfields and the old Moorfields Hospital over at Old Street. So did that kind of make you think actually that NHS estates are actually, and understandably so, quite averse to the idea that you would have somebody design a hospital who's never designed a hospital before?
Well, in the shortlist, we did have people who had not designed hospitals. So in fact, they can go on to say we were shortlisted for this competition, which is a step up rather than not being shortlisted at all. Penoy and Prasad obviously were involved before in Moorfields, but that wasn't, we were just working from a clean slate, and we just wanted to have the architecture and the kind of work we wanted, the facilities we wanted. So I don't think that influenced the fact that Penoy and Prasad had worked for us before. Okay.
I'm interested too in a couple of things actually. One is that I mean, obviously there was, I think it was at the various research, there's obviously been that clear idea that people want to kind of ideally connect good design with good health outcomes. And there's always been that, people have always been trying to make that connect, because obviously if you can prove you can improve health, then you can obviously invest more in design. How far do you think we've gone? I mean, what kind of, have you seen research which can kind of make that direct connection? Because obviously it's a very, very elusive goal, but it would be a wonderful one to achieve.
Absolutely. I think architects are trying to promote this thing that, you know, we create value and we bring, we can connect health and design together. And we can see that, but the NHS doesn't see it quite like that. They're looking at what is called value for money. So everything has justified, you know, salaries, investment in building, everything has to be justified. And I think to justify on the basis of design can be quite difficult, because design is like, you don't know what design is. People don't understand what design is. So it can be quite difficult. But I think the problem or the issue is that if we can show how architects can save time, they can enable patient safety, they can create better patient experiences, those things that I talk about in my book. If they were able to do that in their design projects, then obviously those are concrete things that can be used to promote such projects.
There's a comment here from Cheryl Farrow saying, I'm pleased that primary care was mentioned. There's always so much emphasis on hospitals, but so much improvement possible to many primary care premises and maintenance and cleaning regimes make such a difference, as can be noted by visiting different practices. It's quite funny, I was having a conversation with Professor Alan Short at Cambridge. This is going back a few years now, when he was kind of advising NHS England estates on how to retrofit their estate better. And as part of that conversation, he mentioned that what he found difficult was the fact that if buildings are failing, there seems to be an awful lot of reticence on the part of both the designers and the people who are using those facilities to communicate that information kind of an open way, so that the same mistakes don't get done further down the line by other organisations who aren't aware of the failures of that particular building. And I just wonder whether you think there's kind of an endemic reticence by designers to kind of be more open about the way that their buildings actually perform in, you know, the facilities perform in operation, as opposed to theoretically, or, you know, so that, because actually failures then just carry on going on down the line. Whereas if they get identified as failures for whatever particular reason in a particular building, one can kind of modify that in the next design, for instance.
Well, you know, the thing was, there was a time in the 50s and 60s, 70s, when actually there was real investment into design and hospital building. And those have vanished as money has become scarcer. And this is the problem, I think, with, sorry, excuse me, there's phone going on. the problem with the primary care, as this listener has mentioned, is the fact that you have issues around the estates, and the estates department are not qualified to design this thing. So they actually do some ad hoc arrangements, and what happens is that this carries on and this multiplies. So they do a little bit of ad hoc stuff, and that doesn't work, then they actually end up doing something else to rectify that, and so on and so forth. And I've noted this in many hospital buildings. So they don't call in architects, they just get the estate departments, which don't have design facilities in them.
I mean, that's my primary thing about my experience of kind of modern design hospitals, is that idea that, I mean, you mentioned a lady who couldn't find her baby because she, I do find wayfinding and are really flawed in modern hospitals design generally. I don't know why, whether it's the deep plan or whatever, that lack of ability to kind of associate your place within the building with the outside environment. But it does lead, do you think that's quite an endemic problem in hospital design?
Yes, I mean, that's something, again, I worked with the estates in that particular trust, because what happens is then if you say there's a wayfinding problem, they just put up more signs. Now, this is an eye hospital, and I have to remind them that people don't necessarily read signs or can't read signs. And so the wayfinding has to be intuitive rather than based on signs. But the problem is that because hospitals have been built in that, or rather they've been divided up into corridors and little rooms, and things have been done within the design which worked perfectly before. They put little rooms and divisions and corridors, that it has become really difficult to actually wayfind. And so they have to put up these signs which then don't work. And so in Moorfields, for example, they put a tactile map, a plan of the building that patients with sight impairment could actually touch and find their way. But it has to be more investment into wayfinding. You're absolutely right.
Well, thank you very much. It was, I mean, like I said, a very broad subject, and you're only really touching on it. But I think if listeners want to find out more about it, obviously go to her book, Future Healthcare Design. It's available through RIBAJ bookshops, I believe. And I think, Charmian, there's 20% discount on the books if you put in the code. Is that correct? I believe that's so. But thank you very much indeed, Sumita. It was a great talk. Thank you. And thank you very much indeed. Best of luck with your healthcare, future healthcare work.
Thank you.
Worthwhile. Now we need to move on to our next speaker, who is Allan Hurdle, Technical Consultant at Serge Ferrari Stamisol UK. Regarding the draft Building Safety Bill and concerns related to the evacuation of healthcare buildings, Jane Duncan, Chair of the RIBA's Expert Advisory Group on Fire Safety, was pleased that the government made moves to ensure that safe cladding was installed not only on high-rise buildings, but on high-risk ones, including healthcare facilities. She said that technical intricacies of the cladding ban might have left room for flammable products to still be deemed acceptable. And obviously, given recent tragic events at Grenfell, this is clearly not the case in any scenario, let alone high-rise buildings. I'm hoping that Allan Hurdle will offer some technical clarity to architects in an industry sorely in need of doing so. Allan, you there?
Yes, I am indeed, yeah.
Good morning.
Good morning. And here we go. Are we up and running? Okay, right. Well, welcome everybody. Thanks for coming. As I said today, what I want to do is give you a presentation on what has been developed and what should be required on typical, what is now termed as limited combustible materials, or A2S1DO, and limited combustible products. And this all following obviously after the Grenfell Tower fire, and what products should be suitable and what buildings should be suitable for membranes. Now, it should be understood from an architectural point of view, not every building needs a membrane, but where it should, we should be given consideration to them, because it can have a bearing upon actual building occupiers, building owners, architects and consultants. Because approval document B actually states that for the vertical wall system, it should be to A2 S1DO unless products are exempt. And currently, membranes are exempt. Now, part of that was brought about because at the time there was only a Class B membrane available. Now that is no longer the case. So we know that obviously the tower fire happened in 2017, that's 4 years ago that we know about. And it identified after Dame Judith Hackett, obviously lots of inconsistencies of building design, incompetence of installers, and the use of non-compliant products. And as previously mentioned by a speaker, the race to the bottom on price. Now, Dame Judith Hackett, we know, was given the task of identifying the problems within the UK building industry. And from that, she obviously established the improvement teams, the 12 improvement teams, which are currently underway now. And the big issue, obviously, was non-compliance, lack of competence, lack of independent testing of products, and the poor communication between all parties involved, from architects all the way through to installers, through to the building sign-offs and the final building engineers. This she calls the golden thread. Now, one area that we always need to be mindful of is schools, because the safety of children in schools is paramount, yet typical fires still occur. And 2,000 fires over the past 3 years is obviously one fire too many. Now, this is a frightening figure from a risk assessment that was carried out on over 1,000 schools, which found poor fire protection systems. Now, the systems range from anything from fire doors, lack of compartmentation, lack of the right non-compliant products, and in certain instances, fitting the wrong membranes or the claddings. So where we can fit limited combustible products, we should do. Another area is to show the statistics relating to fires. And it demonstrates that smoke inhalation is more of a threat to life than the direct exposure to the fire itself. Between 50 to 76% of deaths and hospitalizations are through some form of toxic smoke. So it shows us typical levels of fires that can occur in each country with the resultant loss of life. In burning apartments, buildings, hospitals, schools, care homes, the threat of toxic smoke is further heightened if measures are put in place to keep the escape routes clear of the toxic smoke, and by the use of compartmentation and limited combustible products. Now, limited combustible products is just one aspect of building safety, but it's there to help and support escape routes for the residents and workers in a building, and allowing time for firefighters to get to the scene of the fire quickly and as efficiently as possible. So why limited combustible membranes and products are important? A good product should meet the Euroclass standard of A2 for limited combustibility, S1 for smoke, and DO for non-hot droplets. Material composition is made of glass fibre with a specialist coat, and they should meet all the stringent procedures of ISO 9001 with independent certification to meet the EN 13501 Part 1. Now, there are certain companies that are actually putting out that they have an A2 S1 DO, which is non-combustible. But you should question, why are they non-combustible? And are they breathable? Are they waterproof? And do they give you UV protection? And also, what was the time of the test that was taken and the temperatures that the actual test was taken up to? Now, test methods used are part of the Euroclass system to evaluate the limited combustibility. And they needed to meet at least the A2 S1 DO fire and smoke classification in order with the relevant BS and EN standards, particularly around the 13501 2018. But as mentioned, they should be actually independent tested to all the relevant BS and EN standards. A test outs needs to carry out all the above tests on a membrane, and you should always read the test reports carefully so that the commercial implication of the test doesn't overcome and overshadow what is really required in terms of this test certification of the product. Now, this picture is an example which building, it shows you the extent of all the scaffolding required when going through the recladding program. Now, this is obviously in relation to the external wall of cladding, but it just shows you what's involved. And my view is that effectively, if you're going to removing the cladding, then if there is membranes underneath, the likelihood is that there will be a Class C or a Class B, which means there is a chance of combustibility. So if there's a recladding program going on, then it should be looked at to say, should we, if there is a membrane, change the membrane at the same time? It is estimated there could be up to 500,000 people in the UK living in buildings that have the combustible cladding. So there's a likelihood that it could end up having also combustible membranes fitted underneath. So if the cladding has to be removed, then we ought to consider removing the membrane and fitting A2, S1, DO at the same time. Because we actually don't know how many buildings are fitted with combustible membranes. So it could be an actual disaster waiting to happen. Now, we mentioned about typical building applications for limited combustible membranes and products. They are ideal for when an architect wants a membrane to call it, will fit for schools, hospitals, care homes, high-rise buildings, offices and sports centres. In fact, any building where public and residential safety is paramount. Because as we've been proved from Grenfell, the fire is just as bad if it's on the outside of a building as it can be within the inside. So to get people out of a building quickly in a fire situation is obviously crucial. So what does this mean if there is a fire to the health and well-being of occupiers? The most important consideration obviously is about loss of life. But there could also be the hospitalisation of people within the building. It could result in further health issues from the smoke coming through. It can give to loss of confidence of the employee who's in that building. Does he want to go back and work in a building environment? And that in turn could give loss of confidence in their employer of why that building was allowed to do what it did and how it goes, and therefore also lead into this fear of enclosed spaces. So this does have a problem and associated with an employer's performance before and then after the fire. So what does it mean to an employer? Well, again, we're down to this scenario of the possible loss of life. And from an employer's perspective, the building could be shut down. It could result in the risk of investigation of, did you use the right products? Did you have a race to the bottom on price? Is it affecting your insurance claim? And could it increase the costs? And your reputation, could it be affected? And therefore the question goes, could I have done better and were cheaper products my driver over the well-being of the people within a building? A fire has no respect for who owns the building or who occupies it. So we know that as one product, that's just one product of fire and building safety. But limited combustible products can help with an escape in times of a fire. We have to understand that what we're looking for in the membranes is for an A2 product in times of fire, because this will give off, as mentioned, limited fire, low smoke, and limited hot droplets. So it's there to help the firefighters get to the scene of the fire, to reduce the amount of toxic smoke. So it's vitally important that any fire does not produce smoke or limited smoke that will impede evacuation. The more limited combustible products or A2 products that can be used in the building, the safer the building will be. Now, one thing I've touched on is about the importance of independent testing. I know, and there's been a situation where companies state, our products were tested in accordance with. Stating that our products were tested in accordance with does not necessarily mean that it's been independently tested. So the independent test certificate or declaration of performance is of vital importance for architects, consultants, contractors to see about what they're using within that building. You don't want the situation the product has been tested in accordance with, but it's actually an in-house test and been completed by a non-recognised test house. And yeah, okay, yeah, finishing on that thing now. So the watchword is always do the right thing and the right thing now. So summarising on this, the independent test certificate to meet an A2S1DO with a lifetime guarantee for limited combustibility that meets all the EN standards is of vital importance. It should have range screen functions. It should be relevant to reach for chemical substances, give you excellent waterproof thermal protection and solar shaded. Therefore, give no toxic or health issues to the people behind it. So thank you for listening, and that just gives you an overview of what is important and what one should be looking for. Thank you.
Thank you very much indeed, Alan. Your presentation kind of draws attention to me. I mean, the basic problems really with endemic problems within the industry really. One is the idea that the plethora of guidance currently out there for architects is sometimes contradictory. There's loads of it, and how you kind of ally that as an architect in order to make sure that you're meeting, you know, the right guidance is being presented to you at the right time. There's almost a wish to simplify guidance really, to make sure that architects are kind of all being directed to pretty much the same documents as opposed to a whole range of them. That's difficult because we live in a very complex world with very complex materials which will all have different fire properties themselves. So there's this kind of weird mismatch really of the idea of wishing to simplify guidance overall, because that's ultimately what you think. If everybody can be brought under the same kind of umbrella, it's easier to manage the process of designing. But then you've got all these scenarios which are bespoke. You know, you might pick a particular membrane, you might pick a particular form of insulation, a particular cladding. Obviously, bring them together, you're then creating an absolutely bespoke scenario, which in its own way probably requires its own independent testing for that particular builder. And then you have the third aspect, which is there is a demand for higher insulation and efficiency in order to meet carbon reduction requirements into the future. So our reliance more on, let's say, PIR-based products is going to be very hard to kind of wean ourselves off that. They do generally perform better. So how do we as architects kind of navigate that kind of, what I think are kind of, they're scenarios which are actually kind of, they're moving away from each other in some ways. They're not colluding, they're not coming together. They're actually ideas which are kind of drawing, you know, they're pulling away from each other. So how do you as an expert kind of have an overview on that?
You're absolutely right. I mean, even today, people are still making this drive to the bottom on price because the commercial arm of businesses have taken over, unfortunately. And the 12 working groups are scratching their heads constantly, even after 4 years, about what needs to change in approval document B. Now, I have been working quite closely with the Ministry of Housing, Communities and Local Government to look at the approval document B, as you said, about the simplification to try and get to the relevant part you're looking for. And one of them, as I mentioned to you, it states that the outer wall system, a vertical wall system, should be to an A2 S1DO classification unless the product is exempt. Now, I've been in contact and said, look, you do realise now that Class B is no longer a necessary requirement. You can state that the membranes need to be A2 S1DO because they are available. But the message I got back is that, well, we have other issues and a lot of other issues that you're alluding to that need to be addressed first, i.e. cladding, sprinklers, etc. in buildings, looking at existing buildings, either fire doors and education. Now, I do presentations to local authorities, building controls, risk assessors. They actually don't know the products, and the architects won't always know the products that are available. The technical abilities of those products have never been trained in the use of them by those companies. And one thing I always say, particularly as I look around the fire and smoke control industry, is that it's the manufacturers who come up with the ideas who then try and change the guides that then add more complications to the approval document Bs for the architects and the consultants to look at. And everybody will tell you whys or what fors, what you can or can't do. And a contractor, if he's looking to win commercially, unfortunately, he may say, well, it's not in the guides, it's not in approval B or C, therefore we can use an alternative product. As I said, it's 4 years since Grenfell and we're still going through the inquiry and we still haven't come up with certain views. But I do know that from where I stand, competence, compliance, people working with with independently tested products and working together to actually communicate their skill knowledge is an important factor which needs to develop more and more in the future. And it's an important factor. The Smoke Control Association, for instance, have introduced a scheme called the IFC, International Fire Consultant Scheme of Competence, looking at a company. Because you could have a fire engineer in a business that's left university with a fire engineering degree, but has he got the competence to design a building of a high-rise 20, 30, 40 floors? Is his actual competence been over doing a pub or a restaurant at low level? So with any architectural practice or any engineering practice, it's about the level of experience and the types of buildings that they need to work to. And that needs to come out into ensuring that this training and every design and the products that come forward should therefore be referenced by a second person with greater experience, that type of building, to help grow their knowledge and experience. So it is this cross-fertilisation of working and utilising skills.
Thank you very much indeed. I mean, the takeaway from that one, ultimately, Allan, is competence, compliance and independent testing. So, yeah, we still have far to go with all of this, but obviously an important subject, and thank you for coming to talk to us about it today. Our next presenter today will be Laurie Chetwood, founder of Chetwoods. Some of us may be more acquainted with Laurie Chetwood's beguiling architectural drawing style, Flights of Fancy, which on occasion were entered into RIBAJ's own eyeline annual drawing competition. But here Laurie's here in his day job as head of a firm that's developed specialist expertise in the design of modern logistics facilities all over the UK. Chetwoods have been appointed by GLP to develop G Park London Docklands, apparently the UK's first 3-storey logistics facility, providing over 430,000 square feet of space for multiple or single tenant occupancy. Laurie, are you there?
Yes, I'm here. Yeah. Brilliant.
Thank you very much. A wonderful backdrop you have there, Laurie.
Yeah, I struggled into the office despite the weather, so hopefully we're ready. Thanks for the introduction, much appreciated. If I just get the screen up and running, there we go. Yes, so well-being, we've looked at that as a practice in various forms for a number of years, going right back to the Greenwich store for Sainsbury's. I put this up simply because one particular aspect of it gave us a clue to what this well-being and this idea of personal human health is actually about. We did quite a lot of environmental stuff, and I think the environmental stuff is intrinsically linked, obviously, to well-being. But in particular, there's one particular item here, which was about the fact that daylight was allowed into a supermarket for the first time, I think since probably Asda did it unsuccessfully a few years before. And it meant that the retailer said, no, we can't have daylight, we can't bring daylight in because it's going to ruin the products. Actually, we said, no, it's north light, we're going to make sure it doesn't fall on the products. And the thing that really struck me about the whole thing was that we had a dwell time. After the building was finished, they had a dwell time which was almost double what a normal store would be, because people enjoyed being there. They actually went in there, which is unusual for a supermarket, and bought more stuff because they spent more time in there. They weren't going in, getting out as quick as they could because it was a nicer space. And it gave us a clue to this feeling of well-being. How can we capture that? And we, in our sort of slightly cack-handed way, started looking at that as an early version of well-being. We looked at the head and the heart in a sort of metaphor, and we looked at the 5 senses under the head, the more objective, reasonable, sort of efficient and functional. And we thought if we could get the 5 senses sorted out, we get the sort of 6th sense, which is this tingle factor, this feeling that we're enjoying where we are. The middle bit is therefore the harmony, those two things coming together as a sort of 6th sense. And we looked at that a little bit further with the PR guy that we were working with, a guy called Colin Morley, who sadly died in the 7/7 bombing. But I said to him, how the hell are we ever going to get across to clients that enjoying a building is going to benefit them as much as it's going to be something we would love to put in? And he said, well, an enjoyable building is a valuable building. You can peddle that idea as a sort of a slogan, but it's difficult to prove. And at the time it was. So we started looking at happiness and well-being, and you can go on the internet today and just look for 10 ways you can create happiness. One of which, quite an interesting one, is that kids actually laugh 200 times a day, adults about 20 times a day. The idea of creating an atmosphere for collaboration and people talking and musing and so forth is a really good one. Another one is get rid of the rotten eggs in your life. That's a pretty obvious one. But we started looking at happiness anyway. Then we went on to senses, and we thought the 5 senses. If we get all those senses right, are we going to get that 6th sense, that feeling of happiness? So we did an exhibition on that. And I think it is true. Usually, if you don't like where you are or you love where you are, it's usually because you've either got all the senses right or one of the senses is tripping you up. And I used to go and work in the Zeta Hotel, one of ours, and I'd go there because it was comfortable and it was relaxed, and I didn't get designer's block in the office. And I actually used to get, most of the time it was fine, but I'd be tripped up by maybe the kitchen frying the onions, or somebody left the roof open so it was raining on me. But it was definitely a sense that usually tripped me up. We looked at blue zones as well. Where do people live longest? Where is the sort of well-being at, if you like? And this was quite an interesting one in that, okay, the normal ones came up: air, sunlight, water. These particular parts of the world where people live longest benefit from these qualities. They have enough sunlight, they get the best air. Water is at the right level. Diet, exercise. A lot of these are obvious, but the nice one at the end, useful. A feeling of well-being. If you're older and you're actually heading for retirement in our society, you're sort of parked. In these particular places, people are actually used. They're useful. They're useful for their knowledge, and they're seen as seers. They're seen as prophets, and they're part of the community right up until their death. And I think that is quite an interesting point from the point of view of well-being that we need to concentrate on. Obviously, subsequently, we've had a number of drivers that have come since then. And I emphasize that health and well-being is here in the UN Sustainable Development Goals. But the other ones, although some of them are technical and some of them are literal, they do contribute to health and well-being, quite obviously. They're all interdependent. So it's quite an interesting point. And we were desperately keen to, even though we do quite a lot of commercial work, we were definitely keen to try and capture or measure well-being. We started on the environmental side. You can see this one is the world's first development for net zero carbon. But it's a warehouse, and it's a typical warehouse, which I'm going to talk about today, which has moved itself into town. So this is a typical warehouse on the side of a motorway, which generally speaking keeps its nose clean, keeps the goods dry in the warehouse, but makes sure that it's as anonymous as possible, being it's such a big shed. This has now changed, but until that happened, we were doing our best to try and breathe life into those buildings with the benefit of some really excellent clients, GLP being one of them and Baytree being another, where we were actually putting things in here that would help the people who were working there and the people who lived around these places, because they weren't always welcomed. So we looked at duality of purpose, the outside idea, a fire track as a running track. So there's always a fire track around the building. Let's turn it into a running track. Let's connect that to an external gym. Let's create some allotments for people who work there or people who are in the community. We looked inside, plants, living walls, bringing biophilia into indoor spaces. Brilliant. It's known to be a benefit. And I don't just mean a pot plant in the corner. Can we actually literally bring the outside in? Fantastic opportunity. Acoustics, lots of ideas there where you can actually benefit the type of paint. Maybe you emphasize the staircase rather than the lift, so you get people to exercise, that sort of thing. And then very quickly through this lot, we put together for Baytree a kit of parts, a list of well-being benefits, if you like, environmental and well-being, which they could choose from, because you can't do everything. And there's certain things that are more relevant to certain buildings than others. So it's really a kit of parts you can choose from, a matrix, if you like. And you can see some of these here. Battery storage. Can the cladding be battery storage now? Well, that's perfectly feasible. PV on the roof, battery storage in the cladding. You're actually got your own power. We don't have to put it to the grid anymore. You can have your own power for your small lighting circuits and so forth. So anyway, we started from the environmental side, but there was a hell of a lot of it was relating to well-being for people around the building and in the building. Quite an important issue. So looked at detail. It's not all just plain boxes. We've really put a lot of effort into the office element of it all, which included the environmental and the well-being. And then we did some mad stuff, which we won a couple of competitions on. We converted London Bridge into a logistics element, a hub which was served by the Thames. As you can see, the top right, which was 1,000 acres of food production with logistics underneath and fed by the Thames. And then at the bottom right, a repurposed car park. It's a way of moving existing spaces into the public eye to actually engage with people around it and breathe some life into some old-fashioned ideas. Same with this one, a car park in Birmingham, which we looked at, which is a garden on top, and a number of different ideas underneath, certainly not car parks. Then we lurch into China, whereas we're talking about hectares in the UK, we're talking about square kilometers in China. And this was a big logistics park in Wuhan, topically. And the plan was to actually turn that initial settlement into a green and pleasant land on top. With safe in the knowledge you're going to be served underneath, but you're missing out on all the noise and the aggro. It's another well-being idea. And we looked at that and won a competition in the UK with 5 million square feet underground with various connections with a settlement on top. So you living over the shop in a way. A few others, I won't dwell too much on them because I've got to keep an eye on the time. But basic ideas that where we're always considering the environment, but we're always in that same equation, we're talking about the people who live around the buildings. The top left, very quickly, people were more or less where we are, but lower down, obviously, there's a housing estate. They used to walk past this particular site from the canal to the park in the top left. We use the building to supply water to a water park. This is early days with the water park, which gave them an amenity, and we put all the muck and bullets next to the railway in the top left to make sure that the sound and the aggro was away from people. We then took this idea into the 3 markets that we're now moving from London out to Barking. Now, this is quite an interesting point in that we've got to make sure that the logistics building, and the City of London were very keen on this, to make sure that it was part of the community. There's a tendency for some of these markets lately to be closed off. They operate at night and it's fairly hostile when you go there for a meeting at 2 o'clock in the morning. This one is to try and engage with the people, local people, and also to make sure people working there are enjoying themselves. Some of the conditions in these existing markets are atrocious, dangerous, and the health aspects are very poor. So this is an opportunity to breathe life into the idea. You can see the overall element here, the 3 London markets in one place. with attention to the 3 atria. Quick one with you and I. We're working with you and I. Just got planning permission for this. We've been working with OMA, who are doing the Glamour residential on the Thames down near the Blackwall Tunnel route, Morden Wharf. We did the industrial element. Basically, how are we going to get people to go through the industrial element to the glamour stuff, which is the residential, high-end residential, without actually being put off? And we've looked at the way people arrived at this site with nothing or with something, but left with more. So the idea is that you can see into these industrial premises, you engage with the people who are working there, and we've got a park on top. So, and that is linked, which you can't see here, to the park around the building. So it's a step up from an industrial estate that we perhaps had before. This is the building that was mentioned that we're looking at now. It's a 3-story, actually it's now a 5-story building alongside the DLR. It's called Peruvian Wharf. It is on the approach road to the Blackwall Tunnel, and it's a very commercial building. And we're at not really the sweet spot. We're in a difficult spot at the moment because we've always managed to find a reasonably easy planning route to planning when it's on the side of a motorway. When you're in the middle of the town, you have a possible issue with residential alongside, scrutinizing. People are going to be much more aware of what you're doing. This is a big building. There aren't many opportunities from the architect's point of view to do much with it. This was an early idea, this one that we've got here, which changed quite rapidly after this. But there you see the footprint. It's actually top of the screen. It's the service yard. Bottom is the actual warehouse itself, and it's surrounded by ramps. And for various reasons, unbeknown to me, agents have said we've got to have HGVs going up these ramps. So you can imagine the impact that might have if there happened to be housing alongside it. And there is housing alongside it. There's also the DLR and various other issues. So this sort of building now has to start taking responsibility. It has to start to grow up. It can't just sit on the side of a motorway and hope nobody can see it. So we looked at an idea of wrapping the building, really because we had to deal with things like headlights from the HGVs, noise from the HGVs. We wanted the screen around it to be clever. So wherever you went with the screen, it was going to do a job. It wasn't just to hide something that wasn't very nice. So we looked at some of the sketches, we looked at these screens, and a sort of fairly interesting idea started to emerge. And this was the beginning of it. We wanted to make something happen for the DLR. So when you're trawling in the morning, if anybody is these days, you would see something that you could read or learn from. So the big screen on the right-hand side was the possible idea. We wanted people along the base of the building to at least engage with what we've got, which is quite a tricky building to deal with. And so we put in bike storage, we had a cafe, and then we put an art gallery along the front. That's the best we could do. We're dealing with a very commercial sector. You can imagine this is quite a trial. We'd also talked to Newham, who have an architects panel, who are very keen on making sure this contributes to the landscape. So we presented this one anyway, and you can see it sort of in its glory. I was going to sketch it, but I don't think I've got time. Unfortunately, they said, no, we want this to be an honest building. We want to see what it actually does on the tin. Now, that is fine. You can see it on the top left, right? That's how it was. When you put the skeleton up, and that's driven by a lot of factors, not all architectural, we managed to convert it into the top right, which was something. We then added in the well-being idea, which was basically to cross over the top with an amenity deck, which included our running track and our external gyms and a restaurant at the top, a restaurant through the middle. We put sports on the existing car or the new car park that we were putting in. And then down the front, we had an art gallery, another cafe, we had bike storage, and it began to make sense. But sadly, since then, I'll just carry on. This was beginning to be what it was like. A new prospective tenant has come in, and again, these are the bare bones of this building. And any architect looking at this would say, God, what are we going to do? Because again, a lot of it is driven not by us, unfortunately, it's by logistics. So we tried and we looked at the idea of creating some of the ideas we had before, but then we went back and thought, this isn't going to work. We've really got to start looking at wrapping the building again and coming up with a clever wrapping. This were some of the sketches that went with it. So we put a grid, and I'll only deal with one elevation, but we put a grid on it and said, right, what are the things that are important from well-being, the environmental side? just put dots and see what happens. So I really like the idea of actually looking at an elevation and finding out what that particular part of the elevation requires. So a lot of high-rise buildings, you just get the same thing all the way around. It doesn't make any sense to me at all. The whole point of the environmental side is one side of the building will be performing completely different to another. It'll have a different aspect, prospect. Really, the grid idea where you're assigning elements to an elevation is quite a good one, I think. So we started putting dots on. So we know that there's going to be problems with, in the top corner there on the left, you've got headlights coming out of the building straight into the residential, which is on that corner. There's planning permission for a residential a lot this side. So that's an issue. So these are positives and negatives. There are opportunities for obviously displaying to the general public, generally going past in the DLR. Biophilia, important, we think. Maybe we could use the biophilia in the top left to hide some of the problems with the light. So we have a green wall which grows from the bottom, not from the top. And then we have an amenity deck, which again could have an element there. I won't go through it all. We went through a number of iterations, and we're still going through this one. So just to warn you, there isn't really a sort of ending yet to this, but this is what we then did. You then take the dots basically and start sketching where the dots are and what you possibly need. And that, I think, gives you, you're taking into account the environmental side, the well-being side, the people outside the building and the people who are working inside the building. And you start to put this sort of diagram together. And as I say, this is about as far as we've sort of got in terms of this building, and we're due to go back to see Newham with a new iteration on this. And it's a very good process, actually, because we can knock ideas around with the architects and they give us decent ideas back, and it seems to work. So finally, just to bring mine to a conclusion, I found an old sketch. I promise it wasn't something I did just for this. And this was all these musings of trying to get the head and the heart, the two sides of the brain working. How do you get that instinctive feeling that you're going to love this building, the tingle factor? How can you get that into your buildings? I think the first thing is you've sort of got to start pretty early on in the process. So the brief, interrogate the brief and look at it from a well-being point of view, the senses, that head and heart bit. That if you get that right with the right people around you, you do get that spark that I'm showing in the design there that actually hopefully takes you to the next level. And something for Colin Morley, really, when we were discussing this all those years ago, you can now quantify the well-being of a building. It physically is now possible. So if you have a cynical client who's not quite convinced by the fact that you're going to create something that is enjoyable and lovely and is going to benefit them, you can prove that certain things happen to human beings and they're of a benefit to architecture. And I want to just put that in for the benefit of Colin Morley, really. So that's me finished. Thank you very much for listening. I'll stop sharing, and there we are.
Thank you very much indeed, Laurie. That was firing on all cylinders for 10 minutes. Thank you very much. Yeah, intriguing actually. I mean, logistics facilities, a difficult one, because obviously you're constantly dealing with the issue of how to deal with enormous areas. Obviously very much needed. We're all part of the Amazon generation now, unfortunately, or much to Jeff Bezos's love. But here we are, we're dealing with out of town facilities which have enormous demands in terms of, access by HGVs, separation really from the communities around which they are effectively serving, and how do you kind of mitigate all of that? And I think the idea that you're thinking about it on those levels is intriguing. I mean, what I kind of came away with slightly was the idea that, your minority report kind of final thing about how you can actually quantify well-being, I think that's still very much kind of like, in a sense, I think jury's out about that. How does one really evaluate the performance of a building? I think it's great that you think we can do it. And I think there's probably, some evidential ways that we might be able to. But I think ultimately the idea that you're trying to connect a kind of a dumb box facility, which is effectively what it is, with the idea that you somehow at the interfaces of that facility with the world around it, that you kind of create something of a Cedric Price Fun Palace effectively. really interesting conceptually for an architect, because you don't need to do that. You don't even need to think about it really. All they want is the box. But you as an architect are trying to deal with the idea of how does that box interface with the world? And I think just the very idea that you're trying to, you're mapping it, or you're using where does the sun go, or where would a headlight go, or where would the people go? I think that, in a way, I think is a very interesting and constantly stimulating way of you being able to deal with what's a very, very challenging typology.
Yeah, I agree. I think that the good thing about the grid idea is that you have to convince, obviously, the architects at Newham, but you have to convince your client as well. Why are we spending this money on keeping? And if you say, well, it's the headlights, you're going to get stung at planning if you don't control those HGVs and the noise. So you can turn it into a green wall. So it's actually a good idea, but it looks lovely for the residents, but it's also doing a job, duality of purpose that I talked about with the running track and the fire track. And I think it helps the story, and it helps convince your client who's starting to get the hang of, our clients are pretty well versed in the environmental side. You do have to still, nevertheless, when you get to the money, justify spending the money, even if they are well educated in that area.
Do you think ultimately it's an idea of, your biggest takeaway for me from that was the idea that in an ideal scenario, you sink the building. You take it under, you let it kind of naturally go underground, because then you release hectares of space to do something, turn it into a park, or make it build a school on it. Or how do you think that there's a future in that, really, that one might be able to do that?
Very much so. Two very quick examples. Rectory Farm that we're working on near Heathrow. Bloke's taking out gravel. He's got to put a lid on it to stop the gravel going up into the engines. He's turning that, once the gravel's out, into a logistics with a park on top, as you suggested. The other one, we've got a client who's bought a load of multi-storey car parks, some of which go 9 stories down in London, doesn't want to do car parks, logistics. Or a dark hotel, obviously. It could be something similar, but it's what I call hidden spaces. It's a sort of, there's repurposing going on, not just because people are changing the way they're living, but that is a great point you made. It can go down. I think that's what Newham actually objected to when we said we're putting a screen around it. They said it doesn't have to have a screen around it. This should be honest, but you have to have a very, very wealthy client to make that building sing. And that's not always the case. So you've got to use your wits, but going down is possible, but it's just very expensive.
Yeah. Obviously, you want to invest it. You want natural falls in the ground already, or like you say, where it's already been done.
Exactly.
Question from Richard Middleton, just to finish up, saying, have Chetwoods been able to shape a common approach to getting clients to engage, or are they having to work on an individual project basis?
No, I would say that the two clients I mentioned, Bay Tree and GLP, have been on this sort of journey for a long time, the environmental side. So we just sort of almost met in the middle back in the early 2000s. We were pushing it, and they liked the idea, and they engaged in America, quite a famous American on the side of it. So they've been going for this, but there still is, as I said, an economic situation where which ones do you pick, and how can we afford it, and why do we have to do it? There is still that element when they get to the numbers.
Okay, well, thank you very much indeed. That was great, Laurie. Thank you very much for that input. I believe we'll probably have 10 minutes break now, so people can kind of pop to the loo or have a cup of tea. Should we say that we'll come back at around 10:25? We'll come back at 10:25.
If we can ask everybody to come back at 10:20, please.
Oh, okay, 10:20. We'll do 10:20. So it gives us 7 minutes to grab a cup of tea, go to the loo, and we'll be back with our next presentation. Thank you very much indeed. Good morning, everybody. I hope you managed to grab a cup of tea. Sorry it's been so quick. We are overrunning slightly. Our next presentation comes from Alex Street, who's project architect at Reformat Architects, and their study or their work at Wendover Woods Visitor Centre in Aylesbury, which I actually saw on the RIBA's 2020 South Awards shortlist, Regional Awards shortlist, which we published last year in June. It's an intriguing visitor facility with views over the Chiltern Hills, single story building evolved from the concept of a lightweight canopy supported on a forest of columns, which looks absolutely charming. I've not been there, but the photos were great from remembrance. Beneath it, there's internal and external seating areas, there's visitor information points for people enjoying the Chiltern Hills, there's servant spaces, and all having to be achieved with minimum tree removal. A lovely larch-clad cafe from remembrance, which all take advantage of the lovely views of the Chiltern Hills. And Alex, if you could go ahead and give us a breakdown on this building, I'm sure we'd all appreciate it.
Okay, let me just share my screen. You see that? Okay. Yeah, thanks for the introduction. So, yeah, I'm an architect at Reformat. We're a practice of about 20 architects and support staff in Petersfield in Hampshire. Yeah, I'm presenting our scheme of Wendover Woods, which we completed a couple of years ago for the Forestry Commission. So for those that don't know, the Forestry Commission is a government department, and it's responsible for the protection and expansion of Britain's forests and woodlands, and for increasing their value to society and the environment. And it's a public authority, and it's actually the largest land manager and the biggest provider of outdoor recreation in Britain. It manages over 250,000 hectares of public forest in England, which in the southeast includes the New Forest and perhaps more kind of locally important forests such as Alice Holt and Bedgebury and Queen Elizabeth Country Park near us, and of course Wendover Woods. And Reformat had actually worked previously with the Forestry Commission to deliver an expansion to the facilities at Alice Holt. So our work at Wendover was a continuation of that relationship. Wendover Woods is located about 45-50 miles northwest of London, close to Aylesbury, Hemel Hempstead, High Wycombe, and the site covers over 800 acres of woodland, and it's on the northern edge of the Chilterns, the AONB. And over recent years, the forest has grown in popularity and receives over 400,000 visitors a year. And Wendover Woods provides a safe meeting place for friends, families, community groups to come together in a diverse and ancient woodland setting. Woodlands have a tremendous capacity to absorb people, and research has shown that regular contact with natural environments reduces stress levels and boosts morale. And Sumita touched on the wider importance of exercise and well-being to public health. And certainly the Forestry Commission believes that woodlands are a great place for people to take exercise and provide opportunity for people of all ages and abilities to maintain and improve their physical and mental health and well-being. And I think we can all appreciate the importance of having access to natural environments, even more now after the last 18 months, 2 years. Wendover Woods is home to Go Ape, which is a very popular high wire adventure course, and the woods regularly host parkrun events, outdoor yoga classes, Nordic walking groups, and it has an association with the local mountain bike club. And income is generated through car parking, charging on the site, as well as the on-site business operators. And the money generated enables ongoing maintenance of business facilities, making quality recreation access financially sustainable. The woods provide natural spaces, outdoor play structures and trails for children and their families to explore. And there's widespread consensus on the contribution outdoor play can make to preventing childhood obesity and ensuring children's physical and mental well-being. So the existing facilities at the site when we started the project included a relatively small cafe, some toilets, play areas, and obviously significant miles of tracks and paths through the forest. The facilities were all built over the last 40 years and had become inadequate for the growing visitor numbers. And things like temporary portable toilets were required year-round to boost provision, and inadequate car parking and access had become a consistent problem at the site. And the Forestry Commission certainly felt that the continued success at Wendover Woods as a provider of outdoor recreation relied upon improving the quality of its visitor facilities. So the brief essentially was the provision of a new cafe and welcome building, as well as significantly expanding the car parking provision. And the existing toilet block and cafe were then to be converted into new Rangers office, visitor information, car park payment machine, housing, and a new Woodland classroom and event space. So the site is approached via a long access road which runs up from the highway through the woodland for about 3 kilometres, and it's essentially sort of single track road, low speed limit, and it creates a sort of distinctive sense of separation and sets up the potential for a special isolated location in the forest setting. The existing site plan, the existing visitor buildings and car parks, so they sort of sat within a kind of loose clearing in the forest. Activities were fairly disparate, and there's no real sense of place and connection. It's not to say that experience was poor, but we felt a lack of connectivity between the different elements, and the focus on key activities could be improved. So access was from the north, up this 3 kilometre, the end of the 3 kilometre route up, and then some car parking in the clearing, the toilets, the existing cafe, some play spaces here, the Go Ape here. So there wasn't really a real sense of kind of arrival or focus on the actual facilities. But to the south, to the southern edge of the existing facilities, the forest clearing opened up and the topography falls away to offer some long distance views over the Chilterns. But this view is essentially hidden until you happened upon it. So we were keen to capitalise on this view from the new cafe position. So this was actually a sketch prepared by the Forestry Commission's in-house landscape architect, but really shows the main moves. So significant expansion of the car parking provision and rerouting the traffic flow away from the main facilities, and then new paths that rationalised and connected the various facilities with the wider trails network. So in addition to the work that we did, the Forestry Commission instigated significant additional trails through the forest and improved accessibility of some of those. So there was an all-access wheelchair accessible woodland trail that ran through the woods and ran out and returned from the visitor centre. But you can also see the sort of loose clearing in the forest, car parking, arrival, and then that's the existing toilet block, which was then converted as a sort of information Rangers office onto the existing cafe, which was to be repurposed as a sort of outdoor classroom, and then down through to the new cafe, and with benefiting from those views out. So the key driver for us was to provide a coherent and logical visitor experience. So we sort of linked the various functions by this kind of gentle sweeping arc walk, leading from the parking, from arrival, information, welcome, and then to the cafe. So this is a very early concept sketch exploring this idea of this of a pavilion sort of appearing as if floating under a forest of columns, and this is then developed to create a sort of clear experience of walking under a unified canopy and allowing spaces under it to be freely occupied by the cafe, and then the servant spaces of the kitchen and WCs and more solid separate elements slid under the canopy creating a coherent, legible design. The objective of the Forestry Commission was understandably to celebrate the use of timber, a combination of vertical cladding with deep, thin details, playful staggered fenestration, and this sort of unifying, consistent timber-clad canopy floating at the top. This is another CGI view looking from that path out, so this opportunity to walk under the canopy and then be released to the view beyond. The plan is very simple, logical, with a highly glazed cafe area, access from the path, and then new toilet facilities, cafe, servery, staff facilities to one side. Some side section showing the canopy. The Forestry Commission were keen to maximise sustainability, so we wanted to really maximise natural daylight levels. It's naturally ventilated. The canopy, there's a sort of significant overhang on the canopy, particularly on the south side, to aid with solar shading. Heating's via underfloor heating via an air source heat pump. The building's highly insulated, and we made a strategic decision to treat the toilet block essentially as an outdoor element. So the toilets are heated to a fairly low temperature of about 14 degrees with sort of direct, low energy radiant panels, and water for the new cafe was from a new on-site borehole. So this is obviously an aerial view of the completed facilities, and so you can see the new parking area, which obviously necessitated some tree removal. The Forestry Commission actually manages the woodland under a sort of woodland management plan that involves the sort of long-term replacement of some species, so the sort of conifers, with native oaks, ash. So some of that, I suppose initially the feeling that trees have to be removed is uncomfortable, but actually it's part of the ongoing maintenance of the forest. So car parking, and then this new path from leading past the old toilet block, which was converted into information and pay kiosk, past the cafe, and then on to the old cafe, and then onto the new cafe in the distance, with its views over the Chiltern Hills. So this is a view photo on approach to the new cafe, and its position as a destination point at the end of the path. And as the land falls away to the south, you start seeing the views through the glazed cafe, offering this route through the columns and out beyond. And this is the view of the complete cafe looking back up the hill. So this is kind of looking north, and you can see that the linearity of this sort of unified canopy as a counterpoint to the verticality of the surrounding forest. And this shows the relationship to the land as it slopes away, with the new children's play area adjacent to the cafe, with some simple seating. And we formed a sort of Gabion retaining wall to continue that deck terrace level out, and then created some simple step bench seating all the way around to offer places to sit and all the kids play. This shows views through the cafes. There's a real sense of connection between the different facilities. Internally, the Forestry Commission were very keen to celebrate the use of sustainably grown timber wherever possible. So the centerpiece of the cafe is a series of these exaggerated blue lamp portal frames, glazed on all three sides, and top glazed with open roof lights. And this sort of staggered fenestration, which the occupants have the ability to open and close as they wish, and looking south through the cafe out to the dining terrace beyond. And this is a view through the canopy overhang, through the columns, which eventually became powder-coated steel we sort of coloured them in a series of forest colours and offset some of them at different angles. So we think the sort of original effect was still achieved. And then looking back north, back towards the sort of repurposed, retrofitted original buildings. And then this is from the other side, that shows the kind of new paths that the Forest Commission put in were all linked so that there was access at grade on all sides of the building. And then I thought, just in terms of some of the specific products that we used, the Forestry Commission were very keen to celebrate the use of timber within the building. Eventually we used a rough sawn Scottish larch for the cladding boards, and a product that we've used on a number of our projects, which we think with some lots of success, is a Swedish wood protection product called CUX. And it's a sort of impregnation system utilizing silica technology. But the key thing for us, it offers the protection required, but also consistently weathered appearance at an accelerated rate. And on this project, we're very aware of the risk of uneven weathering, as there's timber cladding on all sides into the soffits and big overhangs. And so areas of significantly different levels of exposure. And this photo on the left shows the cladding, which is all Scottish larch, but the cladding to the retaining wall bench seating was put on last. It's from a different supplier and was treated on site with the CUX, which you can see from the next photo that, you know, within a matter of months, the silvering is sort of uniform, which is useful. Another interesting product, or I suppose system that we used, was Abbey Pimford's tree safe ComDeck. It's a proprietary voided pile draft system, and it offers sort of significant time and cost savings on site over traditional pile draft or pile beam foundations, but also more significantly reduces the amount of concrete spoil removal, plant movements required. And in this case, was also used so we could prevent damage to the nearby tree roots that were retained, the retained trees around the site. So it's essentially a system of sort of their kind of proprietary collapsible void forms, which the key thing, I think, is it doesn't need to work off a traditional piling mat, so it's a lot less concrete, it's a lot quicker, work much more closely within the trees. And off of that, we then built essentially a hybrid glue down timber steel frame. So you can see that going up. And then from the steel frame, a series of steel columns around the canopy were sort of, you know, randomly positioned at different angles and rotations. And I included this, just, we're obviously keen to rationalize the challenge of making something look random. So we used essentially a single column set sort of 2 or 3 degrees out of plumb and then kind of rotated around its sort of top axis to get this sort of randomized appearance. You can kind of see that in that photo. And another challenge, initially wanted to do all the windows in timber, but eventually some budget and ongoing maintenance concerns led to a hybrid composite curtain wall system being used. But we worked with SAS, who were the supplier, to develop a system of bracketry based on their solar shading system, which we could then sort of place a sort of a matching timber fin that was sort of bolted and pelleted to those brackets. So you can see those there. And I think that's pretty much my time up, so I'll leave it there. Thanks very much.
Thank you very much indeed, Alex. I think what's quite interesting about that I mean, small project as it is that plan view that you showed, which shows actually the amount of infrastructure one needs to kind of implement in order to create, you know, the architecture to be there, to function. And it kind of reminded me of the my first visit to the Eden project, where I don't know why it surprised me, but actually going in there, flabbergasted at the amount of parking provision that was there. I mean, clearly it's in the middle. And I found it quite shocking. And for me, excuse me, I think it wasn't so much, I mean, here in this particular instance, I think it was interesting for you to talk about the nervousness one has about kind of creating extended parking facilities and the loss of trees in order to do it. But it's difficult because actually one's very kind of like drawn obviously the Forestry Commission is using it as a means of revenue generation. So they want provision in a way, but there's also this potential destruction. There isn't, you know, it is ultimately a form of environmental destruction to some extent, certainly the existing landscape. And I just wondered how much of the conversation was really not so much about replacing the trees that have actually been lost in the creation of the car park area, but the offsetting of future carbon emissions as a result of the number of visitors who'd be going back and forth. I mean, were those kind of big scale discussions ever had at, you know, around the table with the Forestry Commission?
Yeah, to a certain extent. I mean, I think obviously the sort of sustainability and the kind of carbon footprint of what we were building was obviously considered, but also you know, I mean, in that sort of massive 600 and whatever space car park that was created, you know, I can't remember off the top of my head, but I think they're sort of 40 or 50 electric charging points, but then each band in the car park has, you know, sort of future proof. So all the ducts, all the cables are there to offer, you know, electric car charging to every point, essentially. So there's, you know, I mean, it is a difficult thing, isn't it? Because you want to be able to say, well, it's accessible for public transport, and it's but it's an ancient woodland, and that, you know, there is this sort of tension there, I suppose. But yeah, I mean, we tried, you know, to limit it, certainly with the placement of the building as much as possible, to find a position that was in a natural clearing, and that and you know, work quite hard to work as close to the trees and retain them as possible.
And the building's been a couple of years in operation now. How has the Forestry Commission, how's it worked for them as the client, and how do you feel it's worked for the general public?
I think, I mean, the feedback that we've had, I think it's worked very well. What's interesting is that, you know, I think whilst the site was closed at the start of the pandemic, it was obviously one of the first things to open up, and that demand that we all had for outdoor kind of space. So I think it was in huge demand. What's interesting, and it was a kind of throwaway comment from the sort of manager on the site, but he said, you know, because I went up there earlier in the summer, and like all those other, you know, public provisions, you know, there's the kind of yellow and black chevron tape on the floor and one-way systems and all the furniture to one side. And actually, the idea that sort of to go right back to that original concept sketch of a sort of canopy, just a sort of basic shelter in the woodland, and that's sort of how they were using it. You know, I mean, he sort of said, "Oh, we could actually take the cafe away, and we'd still have, you know, because." You know, they wanted that canopy because that's what people actually, you know, particularly in inclement weather, they just want to come and sit under some, you know, shelter. Yeah.
So generally working very well then. I mean,
yeah, I think so. Yeah. I mean, we've had lots of positive feedback, and certainly I think it's, you know, it's difficult. It's one of those, you're sort of trying to provide a focus and a destination, but essentially, as I touched on at the start, the key, certainly from a sort of health and well-being angle, the key thing is to get people out into the forest, and you know, so I suppose offering a hub, a sort of destination, can do that.
Yeah, I mean, that whole idea of kind of something which I think we've got to become more acquainted with, the idea of access to open air and shelter at the same time, simultaneously, which the building provides admirably by the looks of it. Very much indeed, Alex.
Okay, thank you.
Sorry to have to move people on because I am mindful of the time. Our next presentation will be coming from Charlotte Markey, who's Green Urbanisation Innovation Manager at PiP Civils and Green Urbanisation. We don't really need to look any further than Joseph Bazalgette's Victorian interventions on the London sewage system to know that engineering can bring about quite structural and fundamental benefits to urban health and well-being. And with palpable changes to our climate that we're already feeling, most notably, as if anyone's been around in August, in the far higher incidence of concentrated rainfall, Effective urban drainage management has never been more important. Giving her own views on these matters, perhaps, and landscape engineering's links to improved health and well-being. Charlotte, take it away.
Hello, hi. I'm really pleased to be here, and thank you very much for inviting the PiP team today. I'm just going to share my screen, and if you can just let me know that's all working okay. Oh, there we are. Is that better? Oh, sorry, it's there we are. Perfect. So, as I said, thank you very much for being here today. And I'm just going to really take you through a little bit about how PiP has changed to really respond to integrating landscape architecture and drainage, because we all know that as we're developing ourselves into a bit of a pickle, we've got less space to make certain interventions, we're dealing with very constrained environments. We need to think about how we can extend that SUDS envelope to create fully integrated assets, which is really at the core of what green urbanisation is to us. And using engineered solutions to intelligently use, manage, clean water that can then support the green infrastructure. And that can happen at rooftop level, podium level, or at grade. And I'm going to be whizzing through this because obviously of time, but do get in contact if these are of interest to you. We want to enable really the next generation of SUDS technologies by using techniques such as passive irrigation, which means that we can really enhance the biodiversity and other health and well-being benefits by actually using water to irrigate from below the green asset rather than also using water inefficiently by using it as above ground irrigation predominantly. So we want to move on from that. And we use that in our roofs, our tree pits and our rain gardens as well. And of course, this is a scalable solution. And we're also using digital technologies now to map and manage catchments and understand how these green assets can be incorporated. And when we look at it in action and we think of things such as our Green Streets project in the London Borough of Hammersmith and Fulham with integrated trees and rain gardens, we look at some of the rooftop and sports projects where we've used our permavoid units, we can see that health and well-being is really at the core of a number of the projects portfolio that we've been involved in. And I started to think about this and how this linked with wider objectives. And really it's about engaging all stakeholders, so the clients and the developers, understanding about things like biodiversity net gain, architects with a clear vision working with the landscape architects. And of course, as the introduction to this talk alluded to, it's really about bridging that gap between design and engineering so that we can actually make these things become a reality. And that's how we achieve those health and well-being outcomes. So my big question is, what does good look like and how can we achieve that? And we've seen a lot of it today. And it really is about understanding how we can create the connected green spaces of the future and actually using the land we use to landscape to also effectively manage water at source. And if we do that, we get enhanced urban cooling, evapotranspiration, we get passive irrigation, effective use of the landscape. And we've been involved in schemes which we could also consider therapeutic landscapes where green and blue spaces are integrated and they're distinct entities, they're not grey, and also there's so much evidence to really suggest that this is the way we should be moving forward. And one such project we worked on was with our team in Holland, where we actually, in a really old city with lots of existing infrastructure that we had to integrate these systems around, we working on a living and care centre for the elderly. It was this was delivered in 2016. And what we did was we actually used our permavoid units, as you can see here, to create a space and gardens on a podium deck where, because there was no connection to groundwater, we could use the passive irrigation and the permavoid to create a green amenity space for the residents to sit outside, grow their own food, and really connect with that surrounding natural environment. So really sometimes we have to use engineered solutions to create those well-being goals and objectives. And we can see here that if we look at all the different kinds of green infrastructure that we could use our engineered systems to provide, such as tree pits, green roofs, rain gardens and swales, these are all sort of things that the PiP specification team work on. They're all interconnected with different health outcomes, such as mental health, lowering blood pressure, lowering narcotic use, and different kinds of behaviour. So mental and physical health, all integrated with this plethora of GI that we can use to promote this agenda. And this links really, really considerably to biodiversity. And there's so much evidence to suggest that also things like autoimmune diseases are precipitated by a lack of access to biodiverse green spaces and exposure to things like microbiomes that are actually facilitated through increased green infrastructure. So moving from biodiversity to biophilia, how can we make that happen? And we've heard reference to biophilia today and some live projects that have been discussed. And really, we do have this affinity to the natural world. And we can see that planning authorities, water companies, landscape architects and engineers are all wanting to work with us to actually create these spaces that bring people to nature. But we have to do research and development to show how this really can assist us on future projects. So we've worked on a number of schemes across the world, really, looking at how we can capture biodiversity and also water management data to show that there really is a place for engineered solutions in this whole tide of health and wellbeing landscape. And we did a project in Amsterdam where we retrofitted a number of blue roofs to show really that there are increased biodiversity, health and wellbeing outcomes, as well as water management outcomes from having engineered blue roof systems using something such as our permavoid units compared to, say, a conventional green roof. And really it is about using water to add value. And what we found on these schemes was that we could actually double the litres per metre squared of water that we could attenuate at source. So we're keeping the water companies and the engineers happy. But also the species richness that we measured was over 4 times as much as it would be on a conventional green roof. So we're actually adding biodiversity whilst being more intelligent about the water that we're storing. And these are just a few images of the kind of rooftop projects that I'm talking about. And really and truly, these are untapped sources of potential at rooftop level. We haven't really exploited the full opportunity in our towns and cities of health and wellbeing on the roof, as opposed to some of the public realm work that we do at grade. And trees, moving on to trees, this is a big part of what we do as a team, is trying to incorporate trees into a hard landscaped environment. And we all know that we don't all have the benefit of access to a more natural forest. So we have to use the urban forest to deliver health and well-being. This is absolutely critical in initiatives, particularly in a post-pandemic environment. And we know that the benefits for air quality and urban cooling, I don't need to go over those too much today, but we have a range of structural rafted solutions using our permavoid and crated solutions. And we have to work with engineers and in constrained environments to allow projects with trees in the hard landscape to continue. And we've had references to tree planting and incorporating trees onto projects today. And it's absolutely critical that we can provide cost-effective solutions that also integrate trees into the SUDS management scheme, because if we can make an argument for good return on investment and we can use products and systems that not only manage the roots but manage the water, we can create those urban forests that are more multifunctional and deliver those health and well-being objectives. And these are just a couple of the sort of standard details or takeoffs that we might do as a specification team that just show the diversity of work that goes into engineering those tree pit systems under the ground. But the point remains that if we can do all this work to engineer these trees, our urban forest will also continue to provide the ecosystem services it needs to give us health and well-being. If we're taking trees out and they're not properly managed and we're depleting our urban forest because the trees are causing disruption in the hard landscape, we're not really going to have the healthy city centres that we need and deserve. And we can put trees on roofs as well, so we get a sort of, and also on podium level, so we get a multitude of benefits if we integrate them across different types of project, as well as in rain gardens as well. And what we tend to do is use our permavoid system to create or to manage water in two types of ways. We retain some so that we can passively irrigate the water through the tree pit system. And then there's detention volume for regulated discharge into maybe another SUDS feature or into the combined sewer network. And we know that trees reduce the urban heat island effect considerably. And also, if we use engineered tree pit systems, we increase canopy cover, and canopy cover is directly linked to flood control and urban cooling, as we've seen in a Southampton-based case study from back in 2013. And also trees are related to reduced cardiovascular disease and other really important health and well-being impacts. And we all know that there are other case studies where being in sight of trees on hospital sites, which is why we see a lot of green infrastructure on hospital schemes, and we've heard about NHS sites today, they actually can reduce recovery time and really precipitate people getting out of hospital quicker and a faster turnaround. So we know that green infrastructure has huge benefits on NHS sites. We also get involved in rain garden projects using our permavoid system. So we haven't really fully understood in terms of an academic perspective how these new types of GI have an impact on health and well-being, but actually we need to recognise how we can measure the variables. And it's quite challenging to say, if we've got rain gardens and other SUD schemes, what health and well-being benefits they may have. But I think we'll get to a point where in the academic literature we will see that when these are integrated into part of larger connected green infrastructure networks across towns and cities, that they're providing huge health and well-being benefits as well. So we use our permavoid system to create rain gardens. This really does help us to create more aesthetic and beneficial street scenes for both residential and more densely populated inner city kind of public realm projects. And you can see from some of the images that the results are really quite spectacular. If you're managing water appropriately and you can passively irrigate, you could get a really species-rich project delivered. And also we can treat the water and enhance water quality with our permavoid biomat systems. And what we've seen with a number of the projects that we've delivered with rain gardens is that mental health and well-being, residents feeling happier with their environment, reduction of crime rates across cities where you can see a visible investment in the local environment is really critical to the way that we need to be integrating landscape with public realm. And of course, it's all about healthy streets and healthy new towns. And we know that we need to have green infrastructure as part of this wheel of health and well-being. And I know that there's a lot of London boroughs that really do take seriously these healthy streets principles, and relaxation, cleaning air, making easy to cross spaces and places, and also integrating green infrastructure with places to stop and rest, and providing shade and shelter are really part of what we try to achieve with our engineered rain garden and tree pit systems. And we use permavoid under not just swales and rain gardens, but also in cycle routes and thoroughfares as well. And we do try to engage developers on this journey as well. And our team do a lot of work to try and create that best practice exemplar when we're dealing in the public realm. And even things like using engineered solutions under permeable paving can have an impact on health and well-being by transferring that excess heat away and really trying to keep us much cooler. And finally, we've had a really exciting few years working with the Sports Turf Research Institute on how we can integrate our permavoid units under sports pitches. And we can also put these sports pitches onto rooftop schemes as well. And what we find is that these kind of blue spaces and sports field are much more supportive of higher rates and intensity of activity. So there's a lot of academic literature to suggest that if places are greener and there's more amenity, as well as if there's a good engineered solution to keep the surfaces in good condition, we'll find that people will use these spaces. This is just an example of a rooftop scheme where we've got a running track, and we heard about outdoor gyms and running tracks earlier. And also encouraging young people to be more physically active. It's a huge problem to try and get young people into sport and to continue that journey into adult life. And we need to be really intelligent about the way school land is used, because a lot of schools are having to sell off green spaces and maintenance is an issue. So we try and help them on that journey to managing water, but providing space for sport and recreation. So finally, how much green and blue infrastructure for health and wellbeing? I find this really interesting because I've read a lot of literature on biodiversity, and in fact, quality over quantity of biodiverse space is really important. And I wonder if that's the same for health and wellbeing. Is it quality over quantity of these kind of interventions? And I think that's going to be another important part of the literature that it really does inform the way we develop products and solutions and how we think about design moving forward. But I guess the main takeaway from the presentation today, I hope, is that this blend, this admixture of green infrastructure and engineering can help to facilitate both the retrofit and new design of healthy, but also multifunctional spaces, and that as a solution provider, we want to be there to work with the design community to ensure that what is essentially theoretical in the design community at the very inception of a project at the master plan stage can in fact become a reality.
Thank you very much indeed, Charlotte. Thank you very much indeed for that. Kind of a few interesting points actually. Mainly the idea that, well, certainly what you seem to be saying about green roofs and blue roofs, which seem more kind of like in the realm of the architect, as opposed to the idea of sustainable urban drainage, far more it seems in the realm of kind of back to basics urban master planning effectively. I mean, how much do you think architects can actually affect? Because most of these things that you're talking about here are about the engineering of cities, aren't they, rather than architects specifically in buildings. I mean, you can mitigate water, rainfall off a building, for instance, by building a green or blue roof. But are we really talking about we need these things implemented at kind of city scale by governmental organisations?
Yeah, I think that's a really interesting point. And I think really and truly it is a multidisciplinary endeavour, because you need the local authority to have a robust local plan or a design code that really opens up the opportunities for these kind of projects to be realised. So things like the London Urban Greening Factor obviously really unlocked quite a lot of conversation around good quality design and integrating nature into and around buildings. And I think what really saddens me sometimes is there is a bit of a disjunct between architects and landscape architects, as well as engineers. And I think that's really where, if that comes together appropriately, we can realise these schemes much more efficiently at an earlier stage, because the architect knows the kind of space and built form they want to create, but they're not divorced from the landscape. And the landscape architect will obviously have an interest in the kind of planting that's going on a roof or a podium level. And then, of course, the engineer's job is to make sure that there is a robust approach to how water and all the infrastructure involved in the scheme is managed. So for me, it's that blend of disciplines that really can unlock those opportunities.
Yeah, I mean, I think also that idea of well-being, mental well-being. I remember particularly one project, which was it was in the first PiP we ever did, where I went to visit Abu Boda Abbey in Brussels, which is the only project, I have to say, which I ever needed to, as a RIBAJ journalist, to hitchhike to and back from. And it basically had it was a 16th century abbey with a kind of a cobbled courtyard inside it. And they were looking at ideas at how to kind of reinvigorate it so it became more part of the village that it was part of, and more of a tourist attraction, I suppose. And with them, ended up building creating a very shallow drop in the courtyard and instilling a whole kind of like irrigation system that effectively allowed that courtyard to flood. And so by day, it could be used for kind of like village markets, you know, the weekends it was used for farmers markets and stuff. And then, you know, in the evenings, they would slowly flood it over a matter of hours. And actually it kind of became this flooded courtyard, which effectively reflected this beautiful 16th century abbey, and it was all lit at night. And it became something where people used to, the village would actually go and they'd kind of use it far more by night. And I think that way of kind of taking an almost dead village and kind of creating this kind of nighttime beauty about it, which fed, you know, both the well-being of the citizens who were far prouder of it, mental health in terms of people using it by night when they needed to get out of the houses or whatever. You kind of think that actually some interventions can have really fundamental effects to the way that a community kind of exists or uses its space. And I think part of that, of what I was beginning to see, is how fundamental decisions based around how one greens, how one kind of creates irrigation systems or creates water features within urban environments can have really, really fundamental effects to the way that people consider how they live within their cities.
Yeah, absolutely. And we see that, you know, the public realm agenda is really being much more driven by health outcomes now, particularly post-COVID. So hopefully we'll see more.
A question here from Carla, who said, how did the project, I think you recently showed an earlier project in London in Hammersmith and Fulham. She was asking, how did it cope with the recent floods in London?
Yeah, that's interesting. There's probably a network of about 20 streets in and around West London that have got these kind of interventions. And I haven't really dealt with that project in terms of any feedback from the recent floods. I would have to ask our team, but that's obviously something that if it does go wrong, the local authority and ourselves are always in constant contact. And, you know, we do feel that there is an ongoing duty of care to ensure that sort of historic projects perform, and that the residents are protected from those kind of events.
Well, thank you very much indeed. I'm sorry to have to move on swiftly. I'm just mindful of the time. Thank you, Charlotte.
Thank you.
Our final presenter today is Mike Burnell, Project Architect at Hopkins Architects, who will be talking to us about the Alder Hey Children's Hospital Institute in the Park. Hopkins were appointed to design a new research and education building at Alder Hey Children's Hospital in 2013 in Liverpool, following an RIBA competition. That building was completed in summer 2018, winning a RIBAJ Regional Award in 2019. The Institute in the Park was designed to be built in 2 phases on the site of the old hospital adjacent to the new Children's Hospital. And I believe that's what you're going to be explaining to us now. Thank you very much, Mike.
It is indeed. Well, thank you very much for the introduction, Jan Carlos. So I am Mike Burnell. I'm a project architect, as Jan Carlos explained, at Hopkins Architects, and I've been with the company for what is now approaching 10 years. So today, as Jan Carlos explained, I will be talking about Alder Hey Children's Hospital, a project that was completed in 2018. So Hopkins need no introduction to many of you, but for those that aren't aware of our work, it was a practice that was founded in 1976 by Michael and Patty Hopkins, and has helped near British architecture since. So today it's run by 5 principals with 140 members of staff in its London office, and a further 40 based in Dubai. And our work crosses all sectors. And sustainable design has always been a core focus of the practice's work. We work closely with clients to devise long-lasting and economically viable solutions to save materials and energy and reduce waste, while creating this into a rational and coherent architectural style. So we don't produce repetitive, off-the-shelf environmental design. Now, every design is based on a different environment. That environment is different. So why shouldn't the builder's relationship with that environment be different? often producing a happy building produces happy inhabitants. So we find that sustainable design and well-being go hand in hand. So Alder Hey is located in the West Derby area of Liverpool, just to the east of the city centre. And the client for this project was Alder Hey Children's NHS Foundation Trust. The building is a research and education building for the hospital, and is built directly adjacent to the new hospital. I'll come onto that a little bit later. So research and education. Alder Hey conduct paediatric research into children's medicine, infection, inflammation, and oncology. And it has many research partners, which include the University of Liverpool, and is a member of Liverpool Health Partners. Is a world in the provision of education, learning and development, delivering a service which encourages and promotes international learning. And its strategic vision is to ever develop those facilities, which the brief taps in perfectly. So the issue of well-being, healthy buildings is so much more in our consciousness than ever before. We've seen it today from the other speakers. And we as professionals of the construction industry have that moral responsibility to drive these agendas. And that is made much simpler when the clients have aligned agendas, which Alder Hey, I must say, did throughout. So the brief really requested that jewel in the crown. You can see that as central to that diagram. Something that conveys the sense of importance and to reflect the client's institutional ambition. They wanted a stage to promote interdisciplinary collaboration between its many partners, to break down institutional barriers between them. So that includes the 4 university partners which would be based in the building, amongst others, the University of Liverpool, Edge Hill University, John Moores University, and the University of Central Lancashire. So also to put the hospital's research activities onto full display to strengthen the relationship it has with the public, and to ultimately put the hospital on the world stage. And finally, to form a strong relationship with the park. And I'll come on to that a little bit later. You can see on the right-hand side of that image, the previous labs, which were in desperate need of updating. So this is an aerial photograph of pre-2013. So it was before the new hospital was built. The old hospital was built in and opened in 1914 as a military hospital, and that is to the north of that park. So the park there is Springfield Park. So to mark the centenary of the hospital, a new hospital was built, and that was designed by BDP, and that was built on the former site of Springfield Park. You can see that there with the 3 prongs. Our building sits alongside that, as I said earlier, and there'll be a series of other, there are a series of other buildings now, but the completion of the new hospital buildings will see the old hospital site offered back to the community in the form of the park. But where the park and the hospital very much sat as separate entities before, now they're very much interwoven, and you have these green fingers that come into the buildings and between the buildings. Hopkins were involved in the master plan. You can see there we've got the Institute and the park in red, clinical buildings along the east edge, and then there's a series of residential and commercial buildings along the north to provide that additional revenue for the trust to fund the project. The Institute of the Park also, although their footprints aren't necessarily reflected in this plan here, the Cullinan Studios Community Cluster Building and AHMM's Bereavement Counselling Building. And there's no doubt that locating hospital buildings in an environment like this will do wonders to well-being. So planting, plenty of water features, sports pitches, and good, healthy food and drink. So the building and master plan were inspired by Sir Joseph Paxton's Birkenhead Park just across the Mersey. So that park sits as a curvilinear landscape within a very formal gridded Victorian town. So the plan for our building, again, very similar, 2 modular and efficient wings with this curvilinear central atrium which is enhanced by multiple connections, multiple interaction and collaboration at many different levels. And it sits very comfortably in the parkland. The parkland even extends into the heart of the building, and it takes advantage of long views, which are shown with the blue arrows, back to the park. So the introduction of capital and the demolition of the old hospital, with it being gradual and ongoing, our building was designed to be built in 2 phases. So you can see that there. Phase 1 was delivered in parallel with the main hospital, which was completed in summer 2015. And then the demolition of the old hospital enabled phase 2 to be built, which was completed 3 years later in summer 2018. The building is 3 stories, which we felt was appropriate in terms of massing and scale, relating to the existing buildings on the opposite side of Eaton Road, the residential buildings, which is to the east, but also enables multiple and visual connections through the space. That's the ground floor plan. You can see what we've tried to do is expand on the research and education services that Alder Hey places at the heart of its ethos. So you've got 4 lecture theatres there on the ground floor. On the east side, there's a further 2 lecture theatres on the first floor as well above them, and they've got the large glazed picture window ends. There's also a series of seminar spaces, simulation teaching wards. So there's one there in the south wing, a library, breakout areas, amongst many other things. This is an earlier visualization. You can see the increased visibility through this generous atrium provides opportunities for students and the visiting public to observe the inner workings of the hospital research. And we see this ground floor as being very much like a street. It is open to the public, and then those lines of security come off the atrium. And as I mentioned earlier, planting, light being drawn into the heart of the building and onto 2 roof terraces at the end, and I'll show you an image of them later. So it has been spoken about today. There are recognised therapeutic effects associated with the presence of nature and landscaping in buildings. This is the first floor plan, and office accommodation is primarily open plan. So where the accommodation is cellular, we use frameless glazing to increase the daylighting and improve the visibility back into the space. And open plan environments encourage collaboration, but they're not necessarily suited for every single situation. So what this internal arrangement does is it animates a series of open yet intimate spaces that vary in character, size, and privacy, then presenting the users with choice. So you can see here, meeting spaces, breakout spaces, and on the west side there, there's a write-up space as well. And that's an early visual of that write-up space. So very well lit space. And the second floor plan, I mean, like the other floors, really, all the partners that I spoke about earlier, so the trust themselves, also the Alder Hey charity and its 4 university partners, they all share these spaces and are so intertwined within the floor plates. And generous floor plates with a raised floor, a 9-meter structural grid, and a flat slab throughout. So both the wings, the north and the south wing, are concrete flat slab. These enable maximum flexibility for the floor plates to change to meet the constantly evolving needs of its users, and to avoid the hard demarcation of areas. It encourages a sense of porosity across the building. And this is an early visual of the western entrance from the park. So you can see there a boardwalk to the front door with ponds on both sides. And the use of timber externally relates to the building within its parkland setting. And this is where we ended up. So you can see that early vision remained. We used Western red cedar with a Technox Aquatop sealer for the cladding and also the brise-soleil. So the brise-soleil there is a glulam, Western red. And the large brise-soleil, it prevents overheating on the heavily glazed ends to minimise solar gain. And what we've done with the building is we've employed passive measures to create this healthy environment by maximising daylight penetration right into the heart of the space. So not just on those glazed ends that I showed you just then, but also a curvilinear roof light that extends pretty much the entire way across the atrium. And this results in fantastic daylighting through the space. And there's prominence of timber used internally too. So we used Douglas fir internally for the balustrade in there, the planters, the soffit panels you can just see in the distance. And we used ash for the flooring within the atrium spaces and also the collaboration spaces above. So timber is not only sustainable, as we know, and readily available, but research has demonstrated it lowers blood pressure and has a positive effect on mental health. That's the atrium from the first floor, so you can see all the way through that space. This is from phase 2, and you can see through phase 1, and with glimpses of the park to the end. And these are the roof lights that I spoke about earlier. Sorry, the roof terraces that I spoke about earlier. So these are on this second floor on the two ends of the building. And by limiting the building to 3 stories in height, the central stair, that feature stair you can see, what it does is it naturally encourages physical activity, minimizing the use of the lift. That is that stair next to the right of space. And the right of space there. The soffit panels here, you can see they are obviously the Douglas fir that I spoke about. They're slotted timber panels with an acoustic absorption material behind to create fantastic acoustics within the space. And like I said earlier, the wings, the 2 wings are concrete, which is the mass majority of the footprint of the building. And as we know, concrete has a good, very, very good thermal mass. So having this large surface area lended itself to the use of heating and cooling pipes embedded in the concrete. So that was used for regulating the temperature as required. And we used GGBS in the mix, as many of you will be aware, is a byproduct of the steel and iron making industries. And we use that as a cement replacement, giving the concrete a creamy white natural finish. And this gives the internal surfaces a really good reflectance value. And do you remember those dingy, pokey labs that I showed you at the beginning? So these are the labs now. So big, high ceilings, bright walls, bright soffits, plenty of daylighting coming into the space, and really fantastic views out to the park. The modular facade, it reduces cost and installation time, which enabled the money to be spent in the right places through high quality materials and detailing. And it just worked really well, and it installed incredibly quickly. So under those windows, there's air volume displacement ventilation systems, which were sensitively integrated into the facade, and that draws fresh air into the floor void to provide a mixed mode ventilation. But there's not the over-reliance of the BMS system. It's very important that users are given the choice and have that control to be able to open a window. So all the upper floor windows are operable. And phasing, like I said earlier, it was built in 2 phases. There's approximately 3 years between the 2 phases, which did provide some challenges, but through good quality finishing and thorough quality control procedures, the interface is seamless. And what that did was providing a consistency in the specification of materials and products, but also the retention of project knowledge was very, very important. So the contractor and the design team was consistent throughout, and even the same personnel where it's possible. We'll say I was the project architect for phase 2, but I was also involved in phase 1 as well. The building has been open for 3 years now, and the feedback has been incredibly positive. And the client just tells us that everyone's wanting to move in, which is fantastic news. And then I just wanted to say a couple of words at the end. You know, we as architects can control well-being as much as we can in our buildings, but sometimes there are elements that are outside of our control. So, you know, redundancy, unemployment, health issues, both mental and physical, and mental obviously being very, very important through the pandemic. And we at Hopkins are big supporters of the charity, the Architects Benevolent Society. I'm an ambassador for the charity. And what they do is support architects, landscape architects, technologists, and support staff through times of need. And if you have any more questions about this, the organisers can pass on my details. So please do email me. Thank you very much.
Thank you very much indeed, Mike. And thank you for that final point there about the ABS, which is a very worthy organisation helping out architects in various levels of need, given difficult situations. Yeah. As regards your institute in the park, great looking building. You know, really beautifully detailed, as one would expect. I was interested in your use of GGBS and I totally understand, take on board your ideas about the use of thermal mass, which you've quite clearly done. But I was wondering, being a 3-story building, did you ever think about, I mean, given the fact that you've used so much timber in there, did you ever think about making it, was it ever considered that you could ever have done it as a completely timber structure?
I don't think we could have used much more timber, to be honest. Yeah, I do see your point, and it was important to us to introduce that thermal mass. That was such an incredible. It was such an important part of heating and cooling the building. It would have. I think if it had been completely timber, it would have actually used a lot more energy in the long run. Because the thermal mass of the building with those heating and cooling coils throughout, it just did so much in terms of heating and cooling.
Yeah, I mean, it looks great, but I was just wondering, because you clearly love the using timber. I mean, that's clear, you know, so as you say, there's so much of the building is kind of made of it. But I kind of wonder, what was the thing that kind of precluded you from thinking, why don't we just go the whole hog and just design a completely timber building? It
was also very important to us, going back to the first principles, it was also very important to us to have the contrast between that formal, very linear, gridded element to the wings, and just doing something different in the centre. So that atrium, the beauty of the building is that it acts very, very differently to the way that the wings act. You know, the wings are very, very heavy, very formal, very gridded, and that central atrium is where it's all very incredibly well lit, but it's the light streams through. You've got the landscaping coming in, and you've got those beautiful glazed ends with the views out to the park. And
just one more question quickly. I know we now have to round up now. It's coming up to 11:30. I was just interested in whether there have been any, given COVID concerns, have there been any kind of major design changes made to internal office configurations as you originally designed them?
Not at all. Oh. No, I spoke to the client a couple of weeks ago. There's been no changes whatsoever. It's still, like I said at the end, it's still incredibly popular. The building, everyone's wanted to move in. But I think the beauty of the building is that, like I said in the presentation, there's a series of different spaces which can provide an element of choice as to the way that people wish to work. So there are options to go a little bit more cellular, or there are options to kind of space people out a little bit more in the open plan environment. But I do see your point there.
Well, thank you very much indeed. I had a note from Sumita saying that the Alder Hey Hospital actually appears in her book on healthcare design. As well as thank you very much about the ABS representation, and reminding everybody that on the 23rd of September there's a Time to Sketch event coming up for the ABS. Just to finish off, I just want to thank all our speakers. Thank you very much indeed, and thank to you, our viewers as well, for your support of these events. Just to finish off, if you've got any takeaways here, I think with Sumita Singha, she was mentioning there that value for money is what the NHS looks at. So be mindful of the economics behind your good design principles there. Number two, with Allan Hurdle, he's saying don't wait for legislation to drive building and resident safety. Take those things on board yourself. Through Laurie Chetwood, I mean, logistics buildings, enormous. If anything, go down, use a natural site, see what you can do, free things up a bit. Engage with your environment concerning logistics. With Alex Street, views to the natural landscape, also considering carbon footprint, just be more awareness of what your building does and what the servicing structures around it, i.e. the infrastructure around that building, what effects they might have. And maybe architects need to be mindful of that too, as he was. Charlotte Markey, with urban drainage and master planning issue, and generally it is a master planning issue, architects can start with the small things though. Consider your green and blue roofs as being a way forward to manage runoff. And Mike, thank you very much indeed. Great presentation there on Alder Hey. And I suppose a really nice thing to finish up on, that good design in healthcare environments can ultimately be transformative. Thank you very much indeed, everybody. It was a great presentation, lovely speaking to you all. And I hope you join us for the next presentation, which I think will probably be coming up for the next month or so. Thank you very much indeed for your time today, everybody. Thank you.